Hello, welcome back to my channel Beyond Sickle with Liz Owino. Thank you so much to my new subscribers and to my returning subscriber. So today I just wanted to talk about to introduce myself and where I go for my sickle cell treatment. So my name is Liz Owino. I'm 40 years old. I'm from Uasin Gishu County. I live in Eldoret, and I go for my clinic in MTRH, Chandaria Cancer Center. So for the sickle cell clinic, it is usually on Monday and Thursday, but on Thursday, it is clinic for adults warriors. You'll find a lot of sickle cell adult warriors, though you'll also find children. So when you come on Thursday, I'm always there because I'm a sickle cell advocate. I'm also a research assistant and psychological counselor. So what I usually do, I like educating caregivers about sickle cell disease, also educate sickle cell patient, give them hope so that they know that sickle cell disease, it is not a death sentence, but you can just live your life well and do the things that you like. So for a clinic, what I like about sickle cell clinic at MTRH, we have a lot of specialists there. They work as a team. We have psychologists, we have hematologists, we have medical officers, we have nurses, we have physiotherapists, we have child life specialists. So when you come to sickle cell clinic, for example, you have a child maybe from 1 year to 10 years. So rather than them queuing in line with you, they'll go, there's a place that children usually go there. They paint, they draw, they play with toys, so it keeps them busy. And with this approach also, it gives them, like, it tells them that hospital is not a place where they go, they'll be injected, no, but they'll view hospital in a different perspective. So when they go to hospital, they'll be given milk. The child specialist will give them milk and also biscuit, toys, and drawing materials. And then what I also like about this clinic, we have our medication, because there's some donors who sponsor that clinic. You find that we buy hydroxyurea at 15 shillings, but when you go to any pharmacy, the hydroxyurea will cost you 50 shillings or 60 shillings. So for a packet of 100 capsules, we buy it at 1,500 shillings. So that one will encourage warriors to take their medication. And for this medication, you'll be given free folic acid. So currently we also have a program whereby in this program they want to see the intake level of water for sickle cell patient, because in sickle cell disease, hydration is very important. It helps the sickle red blood cell to move freely in the bloodstream, and it also helps to flush away toxic from the body. So drinking water is really important for sickle cell warrior. So when you come to Chandaria Cancer Center Clinic, after seeing the doctor will fill a form whereby you'll be asked how many liters of water or how is your water intake. And then, because when we go to clinic, we also need to do CBC. So from that CBC result, the doctor will fill in all those details. So for the water, for warriors who are 20 years and above, you'll be given this bottle This is 1.5 liters. This one will be given free of charge. And then for those warriors who are 1 years old, 5 years old, or 11, we have a 1 liter water bottle, 750 millimeters water bottle, and 500 ml. So for another thing that I really like about this clinic, we get our vaccine at a very affordable price, because the donor is supporting this program, and this program needs to be sustainable. So for pneumococcal vaccine, we buy it at 2,500 shillings, and for meningococcal vaccine we also buy at 2,500 shillings. And for this vaccine, they are very important because they help. For example, with pneumococcal vaccine, it prevents you from getting chest infection or pneumonia, acute chest syndrome. But if, for example, you get it, it will not be as fatal as for someone who has not been vaccinated. Then for meningococcal vaccine, it helps a patient, it prevents a patient from getting meningitis, and we know how meningitis is fatal. So this clinic is really good because our doctors, they understand us, they know our needs, they know what we really need. And then for the next thing I want to show you, there's a card that they developed for us. So I also wanted to show you why I also love going to the sickle cell clinic at Chandaria Cancer Center. So they developed a sickle cell card, whereby in this card, yes, it has things like sickle cell emergency guidelines. So it will show you, for example, if a warrior is going through chest pain, it show you the symptoms that they will have. For example, they will cough, they'll have shortness of breath, they will have rapid breathing, and then it will also show you some of the complications that sickle cell warriors usually gets. For example, there's priapism, there's severe leg pain, there's a risk of stroke, abdominal pain. So this is the card that I'm talking about. You can just see it clearly. So like you can see it there. It will show you all those things that sickle cell warriors, the complication they usually get. Now on the other side of this card, you'll see that it has a treatment of sickle cell crisis. So on the back side, it will have the patient name, then it will have a date of birth, hospital number, and then treatment of sickle cell crisis. It will tell you, for example, apply heat to the affected area, avoid cold application as this will increase pain. So you can just see this card, and this card is really a lifesaver, because like in this clinic, it not only serve people from Eldoret but from surrounding counties. We usually find even people coming from Narok, Bungoma, Mombasa, Nairobi. They shall come to this clinic. Siaya. So for example, you come from one of those areas, let me say Siaya, and then you can't come to Eldoret and your crisis started. So you can just go to any hospital, and then you can show them this card. When they see this card, they'll see that this is an emergency care and you need a prompt treatment. So your treatment will not be delayed. And even in this card, our doctors usually provide for us their number. So for example, if this doctor has a question and maybe he needs to consult our doctor, they'll just call that number, and then they'll be told what to do, how they usually manage crisis. So it's really a good card. So I really love this card because for example, if I have a crisis and maybe at that time I cannot talk, I'll just remove this card and give it to the doctor who is treating me, and they'll know what to do. And then the other thing that I really like about sickle cell clinic at Chandaria Cancer Center. I love that they have a place, room whereby you'll get your blood transfusion. For example, I've gone to the clinic, maybe I've done my CBC, complete blood count, and maybe my HB was very low, or maybe I usually go for stroke management treatment, like getting blood transfusion, and I don't want to be admitted at the ward. So what the doctor will do, the doctor will just prescribe the blood product that I need, and then I'll go to I'll be given that blood in Chandari as an outpatient. So for example, if I need maybe 3 pints of blood, so I'll get 1 pint of blood maybe that day, then I'll come back tomorrow, then the next day. So I don't need to go to ward so that I can get that blood transfusion, because sometimes in the ward it is always crowded, and for sickle cell warriors we know that our immune system is very low, and so it's always easy for us to get an infection. And then maybe if you came to the clinic and then you are not feeling well, or maybe you came from home and you had a crisis and you don't want to go to the ward, or to be admitted straight to the ward, so rather than going to emergency room, you just want to go to Chandaria Cancer Center. So there we also have emergency room at Chandaria Cancer Center. So when you come there, the doctor will manage your crisis. They'll give you medication there. Then once you have stabilized, the doctor will assess you to see whether you need to go to the ward or you need to go back home. And if you need to go back home, you can just go, and then you'll just be coming there at the clinic to get your treatment. So yeah, that's also, I'd like to encourage sickle cell warriors, caregivers, do not feel like you are alone. We have a clinic whereby they understand us, they don't judge us, they understand our need. So if you have a child and that child needs to start their treatment, you're confused, you don't know which hospital to go, you can come to Chandaria Cancer Center in Eldoret, and I will help you to navigate that clinic, and you'll get that support. And then the last bit, we also have a support group. We know support group is very essential for people living with sickle cell disease and caregivers. This is a place whereby you'll find that you are not alone. You'll be able to network with your fellow warriors, caregivers, medics, and even friends of sickle cell warriors. So you do not need to feel alone. If you come to the clinic, just ask and tell them that you are interested in joining the support group, and I will add you in the group, and you will learn more about sickle cell disease in the group. So in the group, every day we usually have a different topic to teach caregivers and warriors. So for example, maybe we can say today, let us learn about leg ulcer, acute chest syndrome, healthy diet when you are living with sickle cell disease, light exercises that you can do as a person living with sickle cell disease. So when you are part of that group, nobody will judge you, nobody will tell you that people with sickle cell disease, they don't live. You just get the right information. So from this support group, we usually meet every month. So we always organize a meeting for warriors, caregivers, and the young adults. So in this month of August that we are going. Once we start the month of August, we shall have a young mentorship program for the young sickle cell warriors, because this lot is always forgotten and they're just trying to understand who they are. So thank you so much, and I hope I'll see you in Chandaria Cancer Center. And if you have any question, don't hesitate to ask, and don't ever feel alone. Sickle cell disease is not a death sentence. Bye.